may not be able to join. So please, it would be shared on all our platforms so you can also continue sharing to others. Currently, we have more space. And as usual, we always tell you to please tell a friend, because whatever we share here is very important and it is vital for each and everyone. It's, as we said, this month we are celebrating Aphasia Awareness. And we are grateful that we have Priscilla Karen Tete to share this knowledge with us. She doesn't like lengthy introductions and profiles. So the simplest one that she ever gave is that she is a speech and language therapist at Koi Pediatrics. And she is also a part-time lecturer at the University of Ghana. Well, they say those who don't like sharing their accolades, they have a whole lot in store. And we are grateful that Karen has decided to share some of her knowledge with us this evening. Karen, please, the floor is yours. However, please, when anyone joins, kindly mute yourself if you've not been muted automatically. And we are also begging that if you have any questions, comments, concerns, whatsoever, kindly put them in the chat box. When Priscilla is done after her 1 hour, that is if she would like to use all, then you can also share, would ask all the questions, would share all the comments, all the concerns, all the contributions that you have, we would share them here. So please, write whatever thing you want to write in the chat box, and please inform others that the meeting has started. Priscilla, please, your audience are waiting you.
Thank you very much, Haida. Thank you so much for having me today.
You're welcome.
Can we all see the slides?
Yes, I can, but it's not in the presentation mode.
Okay. Is it now?
Yes, please, it is.
Okay.
It is
I'm
now.
so happy to be here today, and I'm grateful. I'm actually honored to be called upon to give a lecture on aphasia. So I know some of us are already in the health sector, and we've heard one or two about aphasia. I wish we were in a classroom so I could ask everyone to put something down, but then I would love everyone to share in the chat box what do you know about aphasia? Something small, just a line or two, so we can all read out. You've heard about aphasia? If you have, what do you know about aphasia? So Ida, would you please do us the honors of monitoring the chat box for us? And we'll come back to that later.
Yes, please.
Okay, so I'm curious to know what others think about aphasia. Anyway, let's just move on, but then we would read that later. So when we talk about aphasia, it's an acquired condition. When we say something is an acquired condition or a condition is acquired, what we mean is that one wasn't born with it. So maybe something happened along the line and the person had the condition. So it's a language difficulty. Before I continue with it, I remember about a year ago, I had a referral from one medical officer, and he said, "Oh, Karen, I have a client I want you to see, and I think she has aphasia." So when going in, I was prepared for aphasia. But then as a speech therapist, I know I should be prepared for any condition. And when I met the person, through conversations, I realized that, oh no, the person doesn't have aphasia. Rather, the person has dysarthria. And so today, we're going to talk about what aphasia is. And I know we have a whole lot of health. Yes.
People have shared something. Yes, we can hear
okay.
you. I'm saying that people have shared something. Can I read them out?
Yes, you can.
Okay. So Tina says that aphasia is a language disorder that affects a person's ability to communicate.
Yeah.
Ekia Nkrumah says a language disorder that affects a person's ability to communicate. ESM says language disorder that affects communication, reading, writing, usually due to a stroke. Salome says usually sudden communication difficulties. Sharifa says expressive and receptive language disorder. That's all for now, please.
Okay, thank you so much. I think most of you know what aphasia is. Either why am I here today? Anyway,
Please, I
let's
don't
go.
know what it is. Some of my parents and other colleagues do not know.
Okay.
Please help us.
Okay, that's fine. And so we know, let me make it very simple for us to understand, because some I'll use the layman terms. I wish I can avoid a lot of jargons, professional jargons today. So we know the brain carries the entire body. If you eat, it's the brain. You will walk, it's the brain. Even your ability to think, create jokes, try to manipulate something, you're still using your brain. And so if your brain is carrying your whole body, then we know that if there is damage to any part of the brain, there will definitely be a function that will be impaired. So I have a very nice picture of Bird from Cleveland Clinic, and we have a diagram here. We have our frontal lobe. We've just labeled parts of the brains that might be impacted. It goes beyond, but then this is just a simple one for you to understand. We have an area called the Wernicke's area, and then we have an area called the Broca's area, and then we have our temporal lobe around the ears, which helps us to hear. It involves in processing what we hear. And then the Wernicke's area, not entirely, but primarily controls or is responsible for understanding, what speech therapists will call receptive language. And then the Broca's area is involved, and then the motor speech area is involved in the production of words, sounds, whatever you've got. That is what controls it. So I've just given you a brief diagram of what I want to talk about today. So I want you to put one thing in your mind: your brain carries your entire body. If you would need balance, it's your brain. If you need to see someone, your brain has to interpret the input coming in. So that's what I want you to put in your mind today. So aphasia is an acquired language impairment. I've already told you what acquired means. It means that one wasn't born with aphasia, but something happened along the line that affected the person's language ability. It's caused by the dysfunction of the central nervous system. Let me put it this way: language centers in the brain, okay? And then it affects your understanding and the production of language. Before I continue, I think I need to make a distinction here. There is a difference between language and speech. Language is a shared code. So if I come here and I tell you, mi amo, if you are not a Spaniard, you wouldn't understand. It's a shared code that all Spanish people understand, that this should be my love. So in Spanish, you can't change it and make it amo me. No, that is the rule. So language is governed by rules, and it's a shared code between a group of people. Unlike speech, speech has to do with the production of the sounds and also your ability to speak fluently and your voice. So there are two different things. So aphasia has nothing to do with sounds. Aphasia is rather language, which means that the code that people share, we all know that if an account tells you, "Fansio breme," you would have to hit to that command if you want to. You're going to bring water. If one is not an account, the person wouldn't understand. So between accounts, we have this shared code that "Fansio breme" means go and bring me the water. And then we can't say "me insio fa." No, it's governed by rules. So language, aphasia affects your language, your ability to understand what people are telling you, and your ability to produce language. That is aphasia. This impairment is in the absence of cognitive impairment, any cognitive impairment. It can coexist with cognitive impairment. However, cognition, if a person has just aphasia, it doesn't affect cognition. So sometimes at home, you realize that someone has aphasia and then we just leave the person, "Oh, this person doesn't really talk well. We don't really understand the person. The person is mentally unstable." No, cognition is intact. It affects language across all components of language. So when we talk about components of language, we have the semantics. Semantics means meaning. So for instance, if I tell you we should label fruits, I don't think when I say we should label fruits, you'd add phone to it. The moment you add phone to it, then it means the category of fruits you do not know. That's why you've added phone to it. It has to do with the phonetics of a language, the phonology, the syntax, how we put words together. Example I gave, we don't say papa, no papa, we say papa no in a can. We don't say Monday, we say the man. So that is how you put the syntax of the language. So aphasia might affect all areas. That a person with aphasia may have, for instance, components like semantics, meaning imparted, that when you ask the person, you show a pen to a person and ask, what is this? The person might say something else. So when we say it affects components of language, what we mean is that putting the words together to form a structure, it might affect any aspect of it. And it's across all modalities. So it can affect one's speaking. Speaking is the same as the speech, the verbal means of communication. Signing is a language. If we don't know today, signing is a language. It can affect one's signing. It can affect an ability to read and also one's ability to write. So the first thing I want you to take home today is that your brain carries your body. And if your brain carries your body, today we are going to talk about aphasia, which is acquired. One is not born with it. And then it's a language impairment that can affect your ability to understand and your ability to express yourself. And it can affect all other components of language across all modalities: speaking, signing, reading, writing. It also affects, sometimes we think as professionals, we only think about the linguistics aspects of it, but then the International Classification of Functioning says that we should think about a person holistically. So how is the condition impacting on the person's ability to associate, the person's ability to function and participate? So if I have aphasia and I'm unable to read and I am a lawyer, how am I going to read and how am I going to participate in court? So we don't just look at the linguistics aspects as speech therapists, but we also consider the social and participation of the person. Now I have an activity here I want us to think about. We'll come back to it later. Kwame, 6 years old, had a head injury. Think about the effect in terms of the structure of the brain and the function, in terms of participation, and also in terms of limitation. I want you to put this in mind as we move on. Kwame is 6 years old. He had a head injury affecting the brain. So I've given you a clue. Structure, the brain can be impacted. So we think about the structure, the function, participation, and then activity. That will be our end of lecture exercise. So did you know the symptoms of aphasia helps in determining the localization, like where the damage is caused? So sometimes when a person has aphasia, and as a health professional, you enter just by looking at some of the symptoms. Let's say the person has a right side paralysis. You are able to tell that, oh, then it might have impacted on the left side of the brain. If a person has balance issues, you know that, oh, then it might be at the bottom parts of the brain. So localization helps us to understand where damage is. So what are the causes of aphasia? We've said aphasia. What can cause aphasia? We have stroke, which we call cerebrovascular accident. And there are types of strokes. Sometimes you realize that when you take a scan, a person has bleeding in the brain. So bleeding in the brain, hemorrhagic stroke, can cause a stroke. That is, we can also have blockage. So there can be a blood clot in the brain, or some kind of debris or fats traveling to the brain. All these things can cause a stroke. So stroke is one of the causes of aphasia. So today, think about it. You might have met someone with a stroke who you knew so well. was participating so well in all activities, was enjoying life, and all of a sudden you visit this person and he or she has difficulty talking. So you ask, oh, how have you been? And they start telling you about some kenke they ate 10 years ago. Then you wonder, what is wrong with this person? We have said that aphasia can affect understanding and expressive language. So this should get you thinking about that person you met some time ago who had a stroke. Now, tumors in the brain, there can be tumors in the brain that can cause pressure in the brain, forcing some of the brain structures to squeeze and affecting function. So that can also lead to aphasia. Head trauma, an injury. I met a boy who fell from the bed and banged the head on the floor and was taken to the hospital and had aphasia. Some infectious diseases like meningitis. I know Dr. Mabel is here. She can throw more light on this when I'm done. And then some degenerative diseases like multiple sclerosis. If you've heard that someone has some conditions and it has affected the person's language, then we would be thinking about aphasia, because this is a person who was well, and now the person has acquired a language difficulty. And this language difficulty has affected the person's ability to understand and the person's ability to speak well. Let me use that phrase, speak well. Now we go to the classification of aphasia. I'm not going to bore you with all these things, but as speech therapists, one of the things that we look out for, where is the aphasia? Is it anterior or posterior? It gives us an idea of what skill might be imparted in terms of language. Is the person fluent or non-fluent? Has it affected the person's expressive language or receptive language? We can use any of these modalities to understand aphasia. So I have a diagram here. It doesn't really look perfect. I tried to do something. Oh, I think I have some part is missing. Okay, Ida, let me just take it off this mode and see. Can we all see?
I can see.
You can see. I think I missed a part, which is fluency. So I'll go back and project it later in slide mode.
All right.
So
no problem.
The first question is the person fluent? If it's yes, then the next question is, does the person understand? So as speech therapists, we look out for fluency, understanding, and then repetition. It helps us to understand what type of aphasia the person is having. So is the person fluent? Yes. Does the person understand what you're saying? Yes. Can the person repeat after you? Yes. Then the person might probably have anomic aphasia. That is naming difficulties. So you ask, you show a picture of a boy and the person they really know what they want to talk about, but finding the right words, naming is a problem. Is the person fluent? Yes. Does the person understand you? Yes. Can the person repeat after you? No. Then we are looking at conduction aphasia. I wouldn't bore you. Let me just brush through this. Conduction aphasia means that there is a part for understanding, there is a part for expressive language. The link might be broken. Now we come back. Is the person fluent? Yes. Does the person understand you? No. Does the person then can the person repeat after you? Yes. Then we look out for transcortical sensory aphasia. Now, if the person cannot repeat after you, then we look out for Wernicke's aphasia. So we have different types of aphasias. This diagram helps us to understand what type of aphasia the person is suffering or the person has. Let me take it back to slide mode. I don't want to bore you so much with the types of aphasias. The speech therapist will really understand what is going on. Sometimes we have a situation where the person doesn't understand, the person cannot repeat after you, and the person cannot do all that you ask them to do. It means that the person has a global kind of aphasia. There is nothing the person can do. Now, what are some of the signs we look out for? Before I come to the signs, I want us to Okay, there are two main types of aphasia. I think I didn't put them on the slide. We have the Broca's aphasia, and then we have the Wernicke's aphasia. It's here. So the Broca's is somewhere here. Sorry, where I have my cursor. And then we have the Wernicke's aphasia underneath. So the Broca's, usually what happens is that they have very good understanding. So you meet an old woman, you meet an old man who had a stroke, and then you talk to them. You can see that they really understand what you're saying. But in responding, spoken language becomes a bit of a difficulty. They have effortful speech. So I'm back to the signs of aphasia. You see that they struggle to talk. Sometimes you realize that they present with something called agrammatism. So the boy is going. They always use the main words in the sentence. So instead of the boy is going, they'll leave out some words like they. So they'll say boy going. You show them a picture of a boy going to school, and they'll be like, boy going school. So they take out some functional words. They really understand you. Oh, what is this boy doing? Showing a picture of a boy going to school. And you see them struggling to bring the words out, and they would end up saying boy, school, go. So those are the those are the main words, and then they leave out the functional words like there and to, the prepositions and all those things. And then they do something called circumlocution. So you can see that it's a tip of the tongue phenomenon. Sometimes you and I face that phenomenon, where we know what to say. The thing is just on the tip of our tongue. We are trying to get it out, but, oh, I know this thing. So you show them a picture of a pineapple, and you ask, what is this? And they try to, oh, that thing that has scales and we eat. You know, they just go round and round and round. They know what it is. It's pineapple. When you ask them, is it a shoe? They'll say no. They really know what they want to say, but it's difficult to get it out. So that is they will try to describe the thing until eventually, maybe if you give a cue, they would bring the pineapple out. And then we have something called paraphasias. So I'll talk about paraphasias in details when we move on. So let me just leave that hanging. And then they have perseverations. Perseveration is when for instance, you've given a picture of a pineapple and you ask, what is this? And they're able to say pineapple. And then you give a picture of a shoe and they tell you pineapple. And you give a picture of a table and they still say pineapple. So that word, their perseveration on that word, it's repeated and repeated, but they know what they want to talk about. But when you ask, did you say pineapple? They might end up saying no. That's not what I mean. So that if you see all these signs with people who have had any kind of damage to the brain, then we are not saying it's completely aphasia, but we will be thinking along the line of aphasia. So what are some, as speech therapists, we look out for auditory comprehension. When we talk about auditory comprehension, it's what you hear, understanding what you hear. So we listen to, as we listen to spoken words, how do we understand it? The sound heard is analyzed. So when now that I'm talking, you are receiving the sounds. You can't see me, but then I'm speaking to you. The sounds are in there. Your brain receives the sounds, it scans. So if I say boy, the brain will scan my mental storage for boy. And then the meaning is assessed. So the meaning that comes in mind would be a male who is young. And probably if I said the boy, you might know the boy I'm referring to, maybe dark skin. So there is a mental image in my brain of the particular boy we are talking about. If I tell you, oh, that naughty boy Yao. If I say that naughty boy Yao, you and you have an image of the boy I'm talking about in your brain. So when you hear that, your brain scans for that image and you are able to assess it. And, oh, that naughty boy has a bushy hair, he's dark, he's blah, blah, blah. So that's one model of understanding. And it's called the Logogene model. There are a lot of models. So I have an example here. If you're not a Spaniard and you hear something like mi amor, your brain will scan but then there wouldn't be anything, you wouldn't make meaning out of it. You might be familiar with the sounds because those sounds are found in English. But then the meaning might not be assessed because you don't have it in your mental storage. And speech therapists, we are often asked, do we do something like a bottom-up or top-down approach of understanding? What we mean is that when I tell you in a can, akukwa bone, you know the next thing that follows it will be kokroko. It's a bottom-up approach. You've already analyzed it in terms of the meaning before coming down to the word. The top-down approach is where you put the sounds together and you scan your mental image you scan your brain for the image and then you make meaning out of it. Forgive me, I'm trying not to use a lot of professional jargon. So in terms of understanding, there's something called pure word deafness. It doesn't mean the person is totally deaf, no. But then the person has difficulty understanding what you're saying, repeating after you, and even writing out dictation. So we usually use a repetition task for that. The person, the inability, maybe it's already spoken language, your inability to understand what is being said, repeat, and even write. Therefore, in assessment, we require the person sometimes to say, to tell us if the two syllables are same or different. So if I ask you ta and ta, are they same? You are able to analyze the sound t and the sound a in both situations and tell me they are the same. But a person with aphasia may have difficulty with it because of the analyzation of those sounds. So ta and ta, they may say it's not same. But if they say it's same, then you have to know that, oh, then they can actually understand what you are talking about. Cat and cat, are they same? They may say yes. Sat and cat, are they same? They have difficulty analyzing. If they have difficulty analyzing, they might tell you, yes, it's same. But in actual fact, they are not the same. And then we have the word form deafness. When a person is asked to match, let's say, a picture with a word. So I have a picture of a hat and I ask the person to match hat to it. Is the person able to match the picture of a hat? So maybe I have hat and I have pen. And I ask the person, oh, I have a picture here. Can you match it for me? They might take hat. If they take hat, then you know that the form of the word is intact. But then if they take pen and they tell you that, oh, the picture of the hat is a pen, then we might be looking out for word form kind of deafness. Assessment usually focus on decision tasks of determining. Sometimes we ask, is this a word or a non-word? Your ability to tell us if it's a word or non-word makes us know that, oh, so the word form in English, we know that we can't say and s do not come together like insure in English. If I ask you, is insure a word in English? If you are an English speaker and you are not even an account speaker, you'll be able to tell me that is a non-word in English. If I formulate any kind of word for you and I ask you, is it a word? You might be able to tell me, oh, no, it's not a word. But if I ask you, is phone a word? You know it's a word. But sometimes people with aphasia may have difficulty with it. It might sound as easy, but it's not that easy for persons with aphasia. Then we have the word meaning kind of deafness. So these all forms under auditory comprehension, your ability to understand what is being said to you. Auditory means to hear. Comprehension means to understand. So are you able to understand what I'm telling you? Even as I'm lecturing now, are you able to understand what I'm telling you? That is the auditory comprehension. So under auditory comprehension, we also have the word meaning deafness. So you may ask, you may give two words which are synonyms, and you may ask the person, are they synonyms? If the person really understands, they will tell you, yes, they are synonyms. So it means that the meaning of the word is intact for the person. If you ask, pretty and beautiful, are they synonyms? And the person tells you, no. Or gorgeous and stunning, are they synonyms? You and I may be able to say, oh, yes, they are synonyms because in our lexicon, they belong to the same area. Let me put it that way. They have the same meaning. So you're able to tell me that, yes, they are synonyms. But a person with aphasia may have difficulty with it and might tell you that lovely and magnificent are not synonyms. So it means that the word meaning has a problem. Now, we've spoken a lot about auditory comprehension. Let me go back. I want you to understand that your brain controls your body. If you will talk, it's your brain. But there are some people who have had some conditions like stroke, like a traumatic brain injury. I met a gentleman who fell from a keke, fell down, and then had some impact on the left side of his brain. So any injury that leads to language disorder, language in terms of how you put the words together, how you express yourself and all those things, then we are thinking about aphasia. And aphasia can affect your ability to understand spoken language. That's what we spoke about. Is it that you have lost the meaning of words? It's still there, but just that connection is the problem. And now we come to verbal expression, which is simply put, when I want to talk about an object, I have to formulate that thing in my mind. I have to have a picture of a dog in my mind. If I want to talk about a dog, I have to have a picture of a dog in my mind. And I need to retrieve the dog from my mind. Know that, oh, a dog is four-legged animal. We can find them at home. They are kept as pets. All these are activated. In fact, verbal expression doesn't come just like that. It may look like a second thing, but it goes through a whole lot of process. If I want to talk about love, if you ask a 1-year-old, or let's say a 6-month-old baby, 1-year-old baby learning how to talk about love, it might sound abstract for them because they don't have it in their mental lexicon. So I need to have it and then know that, oh, the semantic features, the meaning or some features of love has to do with affection. So I consult what I have in my mind. What goes in the mind is what comes out. If you live in a home where nothing about love is spoken, you are kept indoors for your entire life, like a lady called Jenny was, then you don't have anything like love in your mental lexicon. So if I want to talk about love, I need to formulate the concept in my mind. If I want to talk about a dog, maybe I see a dog passing. Oh, that's the dog passing. I need to see it. So that's a sensory stimulation. And then I retrieve the features of it in my mind. Then I consult my mental dictionary. So the features comes in, and then I am able to talk about the dog, or I'm able to say dog, because I have linked the image to the name in my mind. But people with aphasia, it will surprise you that sometimes when you show a picture of the dog, oh, what is this? They may say cat. The reason why they may say cat is that when it gets to the semantic feature activation, the meaning activation, we all know that cats can be found at home. They are kept as pets. They are four-legged. So they have some similarities with a dog. So at that stage, you are able to tell that, oh, then retrieval at that stage is the difficulty. So verbal expression can be a difficulty for persons. So it makes them make a lot of errors. So for instance, if I've made mention of cat, instead of dog, they might say cat. Instead of pineapple, they might say mango, because they all belong to the fruit category. So those are some of the semantic errors. Sometimes they create their own new words. It's called neologism. So they might call a mango boo boo boo. They form their own word. You show them a picture. Oh, auntie, what is this? And then they'll tell you boo boo boo. Retrieving it in that aspect becomes a bit of a difficulty. And sometimes too, they might replace, if I'm able to know that, oh, okay, this is a mat and this is a bat. You show me a picture, I'm able to say, okay, this is a mat. Before I say the mat, I need to put the sounds together. Sometimes at the sound level, they may replace one sound with another, or so substitution. So instead of mat, they may say bat. If you ask them, did you say bat? They'll tell you no. Some of them will tell you no. I said mat. I said bat. They know that is not what they want to talk about. That is people with Broca's aphasia. Surprisingly, people with Wernicke's aphasia, they really don't, most of them don't know that they have the condition. They talk more. They will talk and talk and talk, but they lack meaning. So for them, spoken or verbal expression is intact, but meaning becomes a problem. So when you ask, oh, what did you eat this morning? They start telling you, oh, my son is in school, he's studying engineering. They will go on and on and on. Usually those people, they are not really aware of what is going on around them. But then those with Broca's aphasia, they know what they want to talk about. They might do something called the addition. So instead of sat, they'll say swat. They insert a word, they insert a sound there. They may do deletions, they may say Kate. Sometimes even anticipation, we all do anticipation. Sometimes you're anticipating talking about a word and it reflects in the word before that. So she ate the street strawberries. So instead of sweet, we are anticipating strawberries, which start with STR. So it reflects in the sweet, making our sweet street. She ate the street strawberries. So all these things might be imparted. Now, a person's understanding of written text can also be imparted. So if you give them a book to read, understanding what is there would be a difficulty for them. Sometimes it's even a matter of the difference between this aphasia kind of understanding written text and a child with reading difficulties, that a child's own might be maybe the graphics. But for a person with aphasia, it might not be the graphics. It's just that the whole thing doesn't make sense. So when you have a chat with them, they tell you it doesn't really make sense to them. So understanding written text becomes a problem, and writing might also be impacted. Now, as SLTs, when it comes to assessment, what do? I've been going on and on and on. I know that some of us are not health professionals, but what I want you to keep in mind is, number one, your brain controls your body. So if a person has a brain injury, it might affect wherever the injury is, whatever function that part of the brain has to perform, it might be affected. And aphasia is one of them. Aphasia is acquired, and it's a language disorder. It affects all modalities. I told you about the meaning, the syntax, how you put the words together, and all those things might be affected. And I've also told you that apart from it can also affect one's language. Signing is also language. It can affect writing, it can affect reading. All those things can be impacted. And then when it comes to aphasia, speech therapists can differentiate between a lot of aphasias. But what I want you to put in mind is Broca's aphasia and Wernicke's aphasia. Broca's aphasia, where expressive language or spoken language is impacted, and then it's mainly imparted. It doesn't mean that understanding cannot be imparted, but the majority is the spoken language. And then the Wernicke's aphasia, they talk more, they will talk and talk and talk, but meaning, it lacks meaning. So those are the two I want you to keep in mind. So when you call in an SLT to see a speech and language therapist, to see a person with aphasia, sometimes you want to ascertain the levels of difficulty. So we can use simple, moderate, and complex questions. So we can ask, is your name Kweku? Sometimes it will surprise you. Someone who knows his name for the past 60 years, 70 years. If you ask, who is called Kweku? If you ask, are you Kweku? They'll say no. Are you currently in Ghana? They'll say no. Were you born in Togo? They'll say yes. They are in a hospital. You ask them, is this your home? They'll say yes. It isn't their fault. Understanding is impacted. So we start with simple instructions. Can you point to the light? And you see them pointing to the door. It doesn't mean that they don't have the light in memory, but the connection, I showed you the stages in understanding. The connection might be broken. Sometimes we ask them, as speech therapists, in order to assess their expressive language, we can do a confrontational naming task. What is this? They have to tell you. What is that? They have to tell you. And then we also ask them to repeat words, phrases, sentences after us. All these things are done to be able to tell where the difficulty is and how to approach it. Each person is different. And we also assess their narrative skills. So sometimes you may have, please hold on. I think there's something in the chat. Oh, okay. Very insightful. Thank you very much. Sometimes you may have a person understanding everything, but repetition is a problem for them. Sometimes they understand, but when it gets to narrative skills, so you tell them, oh, when I was coming, I had a 5 minutes traffic jam on the road, and the police stopped me and blah, blah, blah. You ask them to narrate it and it becomes difficult. We give them picture description tags to describe a picture for you. We engage them in conversations to know where the difficulty lies. And all these things, you have to also keep in mind that the individual's well-being and functioning is also assessed. Sometimes each person comes in with his or her goals. I'm a pastor. I want to be able to go to church. So as a speech therapist, you need to keep that in mind. During assessment, we collaborate with families. It's a whole multidisciplinary team thing that we do. We collaborate with a neurologist. We collaborate with a nurse, taking care of the patients. We collaborate with the doctors. We collaborate with everyone. We collaborate with the occupational therapist. So, and even the pharmacist. So all these things, we need to consider the person's well-being and functioning is very, very important. We also assess their reading and writing skills. Their copying, sorry, I missed a Y. Copying shapes, you ask them to copy shapes, letters, numbers, words, phrases, sentences. Don't mind me, I don't want to bore you with what we do as speech therapists, but then I'm just trying to give you an idea of what goes on in the hospital, in the clinic, at home when we are doing our assessment, what we look out for, so that you wouldn't be like, oh, what a dumb question to ask. It's not dumb. We really want to understand if the person is getting the basics. Now, what I want you to note is that aphasia may come with other conditions, other related disorders. You may meet a person with aphasia and you'd ask the person to read, and they might be doing something called the visual field neglect. They might be neglecting some parts of the book. You also have to make sure that they can hear you very well. It can also affect some attention and even prosodic features. Sometimes you might realize that a person has right hemisphere damage. You are talking to the person and their tone is flat. So all these things might coexist with aphasia. When it comes to intervention, what do we do as speech therapists? Intervention is patient-specific because assessment is patient-specific. When it comes to understanding, wherever you see receptive language, it means understanding. We always try to, if the person needs to start from the basics, we try to get them to imitate simple gestures, imitate and understand simple gestures, wave, pretend to be brushing your teeth, let's brush our teeth, let's drink water, let's point, all those things. And then we move on to, we have different stages of instructions. And then we move on to sometimes picture and object or identification. We try to help the person. It isn't, I want you to understand that it doesn't mean the person it's all out of the person's brain. No, it's about the connection, the object, the word, the connection, it's all jammed up in the mental lexicon or your mental library. So we can also start with simple, moderate, and complex yes or no questions. We may do paragraphs with the person. When it comes to expressive language, we may focus on naming objects within a sentence. So sometimes completing a sentence, if you show the person a brush, what is this? It might be difficult. So we give cues. We brush our teeth with air, and you see that it slides out automatically. Sometimes some automatic response. Sometimes we even help them to get their phone numbers back. Someone who's had this phone number for more than 20 years, having difficulty retrieving it. So we are not going to teach the person to learn it, no, but we are going to help the person retrieve it. So we have picture naming tags, we have building sentences with cues, and then our reading also focuses on matching letters, identifying letters. We are matching words to pictures, phrases to pictures, or phrases to phrases, sentences, and then it goes on and on and on. I hope we had an insightful presentation today, and that is it. But I will tell you once again, keep in mind that aphasia is acquired, and it can be caused by conditions like stroke and tumors. injuries, infections. You need to really be taking care of yourself because your family need you and we all need you. Thank you very much for your time.
Wow, thank you so much, Karen. I wish you wouldn't finish. I wish you would just go on and on and on.
Thank you, Ida.
Probably we may need you for something else. I am thrilled, and I know others are also. Well, this section I will have to co-do it with Fiona. So for our questions, comments, contributions, please you can either raise your hand so you are called and then you share, or you can just write it in the chat box. I can see people commending you. These ones will be done by Fiona. So please, Fiona, kindly go ahead and then you can start reading the comments from where Dr. Mabel started from. We've read the earlier ones, so please you can continue from where Doc read from. Fiona, can you hear me? Oh, I think unfortunately Fiona is not able to hear me. Then let me just go on with it for now. So Dr. Mabel is saying that very insightful presentation, an eye-opener. Explanation about verbal expression makes me wonder if our education in Ghana may need to be tweaked to involve more sensory input, and also if teaching in our local dialect may improve our children's understanding and critical thinking. What do you think, Karen?
Can you please? I didn't really get it well.
Okay, let me repeat it. So, Doc was saying that a very insightful presentation, and it's an eye-opener for her. The main one has to do with your explanation of the verbal expression. That's the part that she says that it makes her wonder about our education in Ghana. Do you think we may need to involve more sensory inputs? And also, do you think that teaching it in our local dialect would improve the understanding of the children and their thinking, their critical thinking skills?
Oh, yeah. I think it would. You know, as a speech therapist, if you ask me about sensory inputs, it's always a yes for me because we learn with all of our senses. And so I think there should be a day where we would talk about learning styles, different learning styles. We have different types of learning styles. We have a kinesthetic, we have people who are auditory learners, visual learners. I have two boys, one is a visual learner, one is an auditory learner. I know how to present to them. So yes, and then with our local dialects, yes, we have to. And let me make mention of this. Just this week, I met someone with aphasia who speaks English and Fafra. As a speech therapist, this has nothing to do with the question, but I wanted to chip it in. I decided to, I asked them which language they prefer. They said English. But when doing the assessment in English, I decided to add the Fafra to it. And I realized that the Fafra was intact. So it was rather the English that had the impact from the aphasia. So local language, local dialects, yes, it would help children understand and then it would help critical thinking. I hope I got the question right.
Thank you. Unfortunately, we can't see you when you talk. Would have loved to see you. Thank you. I can be troublesome. Don't mind me, okay?
Oh, don't worry.
Hey. All right. So please go on with the next one. I think the next one, hey, the commendations, there are a lot. Ekia Nkrumah says that thank you very much. Very insightful presentation. And Tina is given all the clap that she has in this world for you currently. Like now.
Thank you.
Esther Quayson says that thank you so much. This is very insightful. George also says very insightful. Success says that very educative, well presented. Zara says, good job, dear. Ah, you see, you had another clap from Esther Quayson. You see the reason why I say you are going to be helping us today and you're going to teach us. Senam is also saying that very insightful. Desmond Lamte says, insightful presentation, thanks. Joel gives you all the fire and praise that he has for now. Elsie says, well done, Karen. This was a very insightful presentation. Gaza says, good presentation, very insightful. Then Dr. Marvel says that, what is the prognosis for aphasia? Can one completely regain their language?
Prognosis for aphasia. Research shows that the first 6 months, because of okay, so I want to avoid professional jargons, but at a point, your brain is made up of neurons that do come together. As you grow up, all the experiences you have, they all connect. Let's say it has these electrical wires that connect with every experiences that you have. When there is damage at a particular side, God has designed the brain is so wonderful that at a point, there might be new connections formed. So if the damage is with this connection might decide to reconnect again. Or different connections might take up the role of what was previously being done by the first new connection, the electrical connection. So your brain naturally recovers. So the first 6 months, therapy needs to be ongoing, because as the brain is reconnecting, it's just like a child coming to this world with nothing in the brain, and then you try to input into the child's brain. So as there is healing, you try to get the person to form the connection stronger. So neurons that fires all the time, when there is more firing of the electricity, it connects them more. So it's very necessary. The first 6 months is very, very necessary for recovery. Prognosis is good for the first 6 months. And afterwards, it's good, but it begins to decline a bit. So we need constant therapy. Thank you.
So therapy all the way. You should make sure you give in all the therapy that is needed. Thank you for that. Okay, so let me continue with the comments, concerns, questions, and all that in the chat box. Eunice Aram Lucy says, good job. I really appreciate the insightful presentation. Elom says, good evening. I am glad to be a part of this insightful presentation. Can children also suffer from aphasia? And Zara responded, she says, yes, they can. Just like you said, it's an acquired condition. Would you like to top up with anything?
Oh yes, Zara is my boss. So yes, she said yes, it's true. It's yes. So one of the conditions like sickle cell anemia, we usually have children with these kinds of condition having aphasia. Maybe Dr. Mabel would be able to understand more because she's a neurodevelopmental pediatrician. But then we happen to see more children with sickle cell anemia having aphasia. And also when there is a damage, any kind of damage, whatever damage that can cause aphasia in adults can also cause aphasia in children. We all know that one of the causes of stroke is diabetes and hypertension. If a child has diabetes or hypertension, it can lead to a stroke, which can also cause aphasia. So yes, children can have aphasia. Thank you.
Thank you for that. Russell Edu Appel says, powerful presentation. Kudos. Daniel Zumakwe, I hope I mentioned the surname right, says, wow, I have learned a lot. It is unfortunate he joined late. Kudos. Don't worry, Daniel. Even if you joined late, the session is being recorded. Unfortunately, we weren't able to stream on our social media platforms like our Facebook and WhatsApp pages. Facebook and YouTube pages. Yet the that notwithstanding, the recordings will be made available to you. So please do not worry at all. And for those who are asking for our the link to join our social media handles or to join our WhatsApp community, please, it has been posted in the page on the in the chat box, sorry. So you can just click on it and be a part of the family. Sabina Ishen says, good presentation, an eye-opener. Then someone with a number says that powerful presentation. Rachel Catty, she's giving you all the thumbs up she has and all the clap she can give for now. Abena says, thanks very much, Karen. Wisdom Donko says that bravo. Then Rachel says, thanks very much, Sister Naki. So we didn't know. Now we know. Sister Naki, thank you. Elom Hayes says, it's depression, anxiety, and any other mental stress linked to aphasia. So Elom wants to know if depression, anxiety, or any other mental stress is linked to aphasia, please.
Linked to aphasia. I'm wondering how it can cause brain damage. But if the other way around, aphasia can cause depression and the anxieties and all these things. Because trust me, this is a person who was going about his or her daily activities, moving about so well, everything was okay. And all of a sudden, something hits the person and is bedridden. The person leaves, walks about, and now the person cannot communicate. So that's why I made mention of the ICF. We consider the person's functioning as well. So if I have to go through all these stress, you can understand what I go through if I don't get the support of the community,
that you need,
my family, and even the government. Because if I'm to go back to work, what laws protect me as a person who has suffered an aphasia? I would have to be home. So yes, but the other way around, I'm not so sure. I haven't seen any research to that.
All right. So Elom says, thank you for the response. And then Erica also adds up by saying that's nice presentation, but is there a situation where one may not recover from it?
I'm very careful when answering questions like this. Well, I would adopt one famous Dr. Tego's technique. Maybe.
Okay. So
Maybe.
current research, you are not sure that it's recoverable,
Yeah,
but then
there are
probably
instances.
with time.
There are instances where someone that might not recover for different reasons. See, the first one is, what is the extent of the damage? That's number one. What is the type of aphasia? The extent of my damage will determine the aphasia. Someone may have damage to almost all the language centers in the brain, especially when it's a hemorrhagic stroke. And apart from the extent, what's the help the person is receiving? That's also needs to be considered. So there are some factors that would determine if a person will come out of it or not. Even personality. I've realized that extroverts, people who are willing to, talk and get in there, usually come out. I don't know, maybe I would have to read about it than those who would want to be left alone, complaining when people try to get in. So yes, a lot of situations may determine.
Okay, so we like that approach of maybe. All right. William Samagri says that such a wonderful and educative presentation. I appreciate and value the close proximity to support a parent aphasia's recovery journey. However, is there a way one can support with the recovery from overseas? Thanks. So I think Sam wants to know if there is any means by which he may be able to support someone with aphasia. Sam, if I am right, if not, you can give further explanation, please.
Is it with the required skill? or help us in resources, required skill. I don't know what he means by that.
Yeah.
But then if it's the required skill.
Or Sam, would you want to raise your hand or unmute and then you
can hear me.
explain further?
I've unmuted myself if you can hear me. Can you hear me?
Yes, please. Yes, please.
Yes.
Yeah. So my thank you for picking my question. I just wanted to know because my mom has that and I come and visit and I help with the recovery, but eventually I'll have to go back and I want to be able to be part of that recovery journey moving forward. And with the advent of Zoom and other remote tools, it makes it possible. But is there a way that with the recovery journey, when I'm away, we can, if it's something that we have to learn, like a speech, by helping her to speak, helping her to play like online games, to kind of jog that part of the language that helps, like Scrabble, whatever it is.
Okay. Thank you for the further explanation. Karen, please, are you clear now? Would you want
Yeah,
to
I
talk
am.
about that?
Yes. I think the speech therapist would have to assess to know where the difficulties lie. Sometimes it's difficult for people to talk. So we have other means of communication. So we have the AAC. We want the person to function. So if we want the person to function, how can we let the person talk about their needs, their daily needs and wants? So sometimes we don't even wait for the speech to come automatically. As we are doing our therapy, we introduce another means of communication so that the person can communicate what they want. And also, we have a guide. Maybe we'll share with you later. It tells you how to communicate with persons with aphasia. You wouldn't have to rush them through. You'd have to, when you go for therapies, we give exercises. I give exercises a lot. I push a lot. So when you go home, you're able to go through at least 45 minutes a day. Engaging with a person helps a lot. So yes, there are a lot of stuff that you can do, but we can't sit here and tell you do A, B, C, D until we know what the issue is.
Okay, thank you.
Thank you too. I think
You're
Zara also
welcome.
wanted to say something. Zara, please, you can unmute and share, please. I think you wrote something to that Telly something also can help.
Thank you very much. So in the first instance, I interpreted his question differently. So I wrote teletherapy can help in the instance where there's somebody at home, and even though the therapist that is outside, since you're looking at outside the country, therapist may not be present, but if somebody is there to assist with the carry-on of therapy, meaning that it's going to be virtual. So I'm going to tell you the questions to ask the person. I'm going to tell you what to do. Print out these materials. You can print out these materials and I can educate you as to how to go about it. In terms of therapy wise, yes, like Zoom and other virtual mediums, I can sit from my ends and tell you how to go about it each time, each day. Yeah, so that's how come I said teletherapy can help. And then I wanted to add on in terms of the support system. In my research, I worked on aphasia and the support systems, how to support persons with aphasia. And I realized that I drafted about 7 different support systems, and I noticed that most of the persons with aphasia wanted more of the social support system than the financial support system. It looked like although the financial support system was there, those that recovered faster were those that had the social support system, that had people come around, church members come around, family members were there, their grandchildren were there if they are much older, and their friends from school were there. The recovery process was way faster than those with spiritual support, those with emotional support. Emotional support also received much faster results in terms of their recovery. Please, can you hear me?
You went off a bit, but we can hear you now, please. Please go on, Zara. Hello, Zara. Zara? Oh, am I audible, please?
Yes, please, you are.
Yes, you are.
Yeah.
Okay, so then I think we may have lost Zara there. Zara, please, if possible, kindly reconnect and let's go on. All right, so let me continue with what we have here. Dr. Mabel is saying that, so she wrote,
I can't hear you, please.
I muted myself. Thank you. Thank you very much. So Dr. Mabel is saying that complications of sickle cell anemia is strokes, hence seeing aphasia in some cases. Okay, Prince Stepper is saying that number one, how can I help someone with aphasia maintain their independence? Secondly, please, with the explanation given, can aphasia differ with the language? Karen, would you want to take it one at a time, or should I read everything from Prince Stepper, please?
One at a time will do. I'm trying to follow,
Okay,
but
so
I can't. Okay, I can see it now. How can
okay,
I help
so from
someone with
Prince,
aphasia maintain their
maintain their
independence?
independence.
Inclusion. Everywhere we preach
Okay,
inclusion, and we shouldn't let them
okay,
feel so. There's this band that I often see around the hands of people with aphasia, not in Ghana. I have aphasia, my cognition is intact. So we shouldn't let them feel that they are dumb, but rather we should include them in conversations. Also, when you're giving exercises by a speech and language therapist or any therapist, you should do well to take them through, understand, have empathy, not sympathy. Put yourself in their shoes, understand them. And yeah, when we include them, they tend to live longer, they tend to engage more. And just as Zara said, the social environment also helps. So participation is important, and being able to function well also is important. Thank you. And then the second question is, please, with explanation given, can aphasia, can it differ with the language? Yes. Sometimes as speech therapists, we get, that's why I gave an example of a gentleman I met just this week whose frafra is intact. It affected the frafra differently, not so much as the English. You might also have, I think there's been some researches that suggest that some people would also have maybe, if it's Akan, comprehension of Akan a bit imparted, and then maybe expression of Fafra a bit imparted. So yes, it does. It can, but not so, it's rare though, but yes, it can. What are some strategies for coping with aphasia? Whoa, it reminds me of my aphasia class. Anyway, the person coping with aphasia, they should, number one, understand the condition itself. And number two, before coping, whatever is the underlying factor that led to the aphasia should be managed. So if it's the diabetes that led to, before coping, I want to talk about, if it's diabetes, you have to make sure you manage the diabetes. If it's hypertension, you manage all these things so that there wouldn't be a recurrent stroke that can lead to a much worse form of aphasia, because the more damage it causes, the more function is impacted. So what are the strategies? Number one, you have to understand what you are going through. Number two, you need to get your therapist involved, and also getting involved in the activities that you can get involved in. And then the use of AACs help a lot to cope with. So there are some people who have had all forms of conditions that have impacted their speech and language, and they are coping so well because they are relying on other means of communication. So if it's maybe a communication board I'm using, I'm able to request for anything that I need to request for, and I'm perfectly okay. I'm communicating. Communication shouldn't be just speech. All other means that one can talk about their needs, wants, comments, whatever. So one can cope with aphasia when they are able to have therapies, they're able to have other means to communicate their wants and needs. Yes, they can, one can cope with the aphasia. Thank you.
Thank you so much, Karen. And Sharifa is also thanking you for the brilliant presentation. And her question is that, do we manage it differently between global and mixed aphasia? I think the question is asking about its management.
Yes.
Is there a difference in managing it between global and the mixed?
Yes, there is. Even with the mixed aphasia, you might not meet, there is not a clear cut on it. Everyone is different. So we manage, the labeling is not really as important as what the person is presenting with. So we manage aphasia per what the person is presenting with. You may meet someone who has Broca's aphasia, another person with Broca's aphasia, but one person's Broca's aphasia may be difficulty with naming everyday objects. Another person might be okay with everyday objects, but when it comes to the phrases and sentences, that's where the difficulty lies. But they all have the same labeling. So we don't really rely so much on labeling, but we are very much concerned about what the person is presenting with and treating what the person is presented with. Thank you.
Thank you. Thank you so much with that. Okay. Elom is saying, okay, I think I have read these ones already. Wow. Have I mixed up my messages? I think I have. I think I have. I'm trying to, you have a whole lot of commendation. Okay, so Ikuya is, before Ikuya, Mary Asari Yeboah says, thank you very much. Kudos to Madam Presenter. She is Karen, so kudos, Karen. And Ikuya Nkrumah says, I think she's asking of the duration of symptoms and if it and how it affects recovery. Hello? Hello.
Hi.
Hello.
Okay. I don't know whether, please, those who are not asking questions currently, kindly mute yourselves. You'll be helping us by muting yourself. Senam has a hand up. Senam, please unmute yourself and ask your question.
Okay, good evening.
Good evening.
Good evening. Please go ahead, Senam.
Okay, please, is there a difference between aphasia and dementia? I just want to know.
Oh, yes, there is. But you might have someone with aphasia. Dementia is more of memory kind of difficulty. And then you might have someone who has aphasia and dementia, but then there are two different conditions. I don't know if Dr. Mabel would want to add to that.
Doc, would you want to add to that, please? Hello, Dr. Mabel. Okay, then before Doc continues, Elom is saying that she believes educators, especially the preschool teachers, should be trained in speech and language therapy to identify and recommend necessary intervention one may need.
Oh, okay. Unfortunately, Doc is not able to talk where she is now. So sorry about that. But she would send in whatever she has in the chat box. Someone has written a comment. He has no name written here, but the comment says that I believe that integrating this into our education curriculum will significantly enhance critical thinking abilities and enable children to better comprehend efficiency. Good job and very insightful. If there is, okay, Esther has written something here too. Esther says, hey, I'm sorry, please, can you all hear me?
Yes,
I
we
can hear
can.
you.
Oh, okay. Because someone is saying she's unable to hear anything. I'm sorry, my background is a bit noisy. Okay, so if you can hear me, I'm grateful. Elom is saying that she believes educators, especially preschool teachers, should be trained in speech and language therapy. Okay, I think I've read this one. To identify and recommend necessary intervention one needs. I've read this already. Nadia Amakakra says that for those who cannot use AAC, how best can we encourage them to help children with aphasia? Hello, Karen, can you hear me, please?
Yes, I can hear you.
Okay.
I'm trying to understand the question. For people who cannot use AAC, so those helping people with aphasia, if they cannot use AAC.
I think so. I think that the therapist or anyone else who is giving support.
Oh, anyone giving support. Oh,
Yes, please.
Believe me, AAC is one of the simplest things to do. We have different types of AACs. We have the high tech, we have the low tech. Low tech are simply pictures. So if I come to you, okay, so let me give you an example. If I come to you and I feel like drinking water, but I sign the water, you're able to tell that I want something to drink, right? You're holding water and I
Yes.
come and I sign water. It's a form of AAC. So you don't need any sophisticated way of using AACs. No, usually the therapist will teach you how to do it. They are just pictures. We have pictures that you can use to make requests. Do you get the point?
So I do. So that is the reason why you kept mentioning that signing is one of the ways of communication. So it is not only about the talking and the talking and the talking. Thank you so much. Okay, so Nadia says she understands that, and thank you for that. Emmanuel says, please, can we give a strong education to the parents about prenatal stage of delivery so that all of these conditions can be prevented right from the beginning? Emmanuel, I don't know whether you were here in the initial stages when Karen started. She made mention, and even the comments in the chat box earlier, they said something about what aphasia is. I don't know whether he was here, so I'll presume he wasn't here when you started, Karen, because you mentioned something. There's a word that has stuck with me: acquired. Or Karen, am I wrong?
You are not either. It's acquired. So one is not born with it. So maybe one day Ida would want, or missions would give us education on some conditions that impact on speech and language that one is born with, some developmental conditions. But aphasia is acquired, Emmanuel. Thank you.
Thank you so much. Oh, you just joined. Oh, so sorry. Then please make sure you are able to listen to the recording when we make it available. Okay. And then Doc also mentioned something. She says the biggest risk factor for dementia is aging and genetics, and aphasia is acquired through traumatic brain injury. So please, for the earlier comment on dementia, and aphasia. Please, let's make sure we get this correctly. All right, Joe Carl says, if I may ask, what is aphasia? What causes it? Hey, Joe Carl, just join.
So let me summarize
this one, I am asking for Karen. Please, Joe Carl, did you just join? or Karen, I can't answer this one for you.
Oh, you can, but let me just summarize it. Aphasia
All right, so
is a language.
She's doing you a favor. Thank you, Karen.
Difficulty. It's a language difficulty. So if a person wasn't born with a language difficulty, and they had a condition like stroke, maybe they fell, they banged their head, and so they had some kind of injury to the brain, then the person might have aphasia. That's depending on where in the brain is impacted. If it's at the language centers in the brain, it might affect the person. So aphasia is simply language difficulties caused by injury to the brain. Thank you.
Thank you so much, Karen, for the summary that you've given. And since the summary has been given, it has summarized everything that we've been able to do for today. I must say a very big thank you to Karen, who made the time, energy, the efforts, her resources, and everything to join us. For those who joined late, don't worry. The program is being recorded. So when we're done, we will ensure that we share them on our social media platforms. That is our Facebook and YouTube links. You can have it there. Those our link for our WhatsApp community is also posted over there. So please, you can join our WhatsApp platform, join our Parents Roundtable community. Then from there, you will be able to have access to any other thing that we would share with time. Please bear in mind too that next month we are having a special education and inclusion webinar. Well, we're still open, so you can still join us. Do make a date with us. Please join, register, especially for the schools. Do register to learn a whole lot. I know that there are some packages that are being given out. So if you have any questions, concerns, whatsoever, please contact us. Ask us all the questions you would need to ask us, and we would avail ourselves and ensure that we give you the correct responses and the right ones for you. We thank you so much, everyone. Thank you, Zara. Thank you, Karen, for everything. We are grateful to each and every one of you who made the time to join us. We appreciate you. We appreciate the fact that you keep joining us the fourth Sunday of every month. You do join us. You do listen to all our monthly lectures. We are grateful for everything. We thank you, and please keep sharing this with others also. Help us raise awareness. Help us help others also get to learn. As our links are available on our pages, please share them with others too. Let them also be a part of the community. Let them learn from everything that you've acquired. The more we share, the more we enlighten others, the more we also help society and the community at large. We are grateful to everyone for being here. Thank you. Karen, we can't say thank you enough. Thank you so much. Thank you so much.
Thank you to everyone for being here for me.
All right. So please, let me repost. Someone is just asking for, on Facebook, it's Mission Pediatrics. The pediatrics is without A. It's PE, the American spelling, please. So PE, no A. It's no A there. So please bear in mind. I want to repost the link we shared earlier so that you can also have it. You can all have it, be a part of it. Hey, why is technology not allowing me to make use of it? Okay, so please let me just copy it from another page and post it here. Or has someone reposted it for me? Okay. I am reposting it. So for those who do not have access to it, you can please join our community pages. Our social media handles, yes. Please join our community page, and then we'll share all our other social media handles there for you. Anyone who missed it, we'll get to post it there. So, Mrs. Edupa, thank you for the wonderful presentation. Yes, you didn't want to share a lot, but you see, it's a small world. we get to see and hear things. So, Mrs. Edupa, thank you. You are muted, by the way, but please have a very good evening, everyone, and do enjoy the rest of the week. And have a great one.
Okay.
Bye.
You too. Bye.